Hey guys, it's Christian from deathofacne.com. This is a very important video to me personally because I know how many people struggle with severe acne and Accutane usage. I want you to check it out.
Alright, look, I know how psychologically traumatic severe acne can be. I had it, and one day I was literally, this information was sat in my lap and said, this is the most powerful drug on the market, but it has these side effects. And I, even for a second, was thinking about going on it because everything I had tried had failed. Life-threatening and acne treatment usually don't come up in the same sentence, but they do with Accutane. And so you might ask, what is Accutane? Well, it's a derivative of vitamin A. And its success comes, or partial success, you have to take it for like 6 months every day, comes from minimizing the sebaceous glands, which dermatologists believe get overproductive and can cause acne. Now what Accutane does is severely cripple these glands basically so that no sebum can reach your face. It's evidenced by a lot of Accutane sufferers. When you see their lips, they're so dry because they have to put, because it basically sucks all moisture out of your face and directly into the middle of your body somewhere. I don't know where it goes. It's usually prescribed as kind of a last method, kind of last result type deal when you've tried benzoyl peroxide, salicylic acid, retin A, topical antibiotics, oral antibiotics. The drug of last choice is Accutane, in which case most doctors out there won't even give their patients because of the research that keeps coming out, the mounting evidence against the drug, and its ridiculously harmful side effects. So let me walk you through a little bit of it. The only way to get this drug legally is through a doctor, and you have to sign all types of permission slips saying that you won't kill yourself, you won't blame it on the drug manufacturer, and if you're a woman you have to sign something called I Pledge, which means you have to take 2 forms of birth control pills and submit a monthly pregnancy test, because if you ever get pregnant, it's basically guaranteed that your baby's going to have birth defects because it just crushes their central nervous system and will cause a variety of birth defects that I don't even want to go into because they're so frankly sickening. But that's not even taking into account any of the studies, because there haven't been any, that have done research on long-term effects, women down the line having babies, and whether or not that previous doses of Accutane can still cause birth defects down the line in their children. Another reason why you should never, ever, ever take Accutane. As referenced here, in 2006 a study said that taking Accutane caused patients to have elevations in total cholesterol, serum triglyceride levels, decreases in white blood cell triglyceride and platelet counts, as well as chemically induced liver damage. There's a much better way of healing your acne than going on to a drug like this that would produce these. I mean, a patient, it says right on a lot of the websites and research, they have to go in for every 2 weeks and get lab tests done to make sure that their body is basically not dying from the inside. Or how about this? 12 million people worldwide in 2001 were taking the drug. We've seen a drastic increase in the amount of doctors who are willing to put their patients on these types of drugs, which is, I would be embarrassed to subject my patients to this type of side effects and potential disasters. If you go onto the US FDA's website where they report Adverse Event Reporting Systems, AERS, it contains 23,000 reports of people who had suffered from side effects or trauma or something like that from isotretinoin. But let's get a show of hands. Who has ever gone to the FDA and complained about something that's gone wrong with their drug treatment? Not that many. So you can imagine how underreported these statistics are. When you talk about 23,000 people since the drug's been in existence since 1982, think about how many more people are actually complaining but never go on to bother to report it. Here, a study in 2002 said that there were 173 reports of suicide. I think this study was the most important study to know whether it worked. If 173 people kill themselves while taking the drug, how effective would it be? Why would they kill themselves if they were curing their acne? If it worked, why would they kill themselves? Honestly, have you ever talked to someone who was depressed that they cured their severe acne? I've never talked to anyone. Usually people are just like ecstatic and can't wait to tell the world. So I mean, I don't know how the drug could honestly work for everyone. So in a study in 1986 said approximately 15% of patients treated with isotretinoin developed musculoskeletal symptoms and occasionally increased creatine kinase activity, which is a muscle enzyme that is a marker of severe muscle breakdown and muscle dystrophy. How about a study in 2005 I'm reading is at the completion of treatment, those who were treated with isotretinoin had an average of a 21% decrease in orbitofrontal cortical metabolism, which is medical jargon for 1/5 of their brain metabolism stopped working. If you go on to take the drug, they tell you to avoid a couple things, like donating blood, taking a vitamin A supplement, doing any sports. I know it sounds kind of ridiculous, but it makes your bones very brittle. So if you're ever doing a sport that could cause you to get hurt, they say don't do it because you'll probably fracture something. They also say don't go into the sun because it makes your skin sensitive to the point where you would get severe skin damage and set yourself up for long-term skin cancer. This is where I'm going to go off on a little tangent here and I'm going to read every one of the side effects. So if you want to take a glass of water and listen to me for this, here they are. Depressed mood, trouble concentrating, sleep problems, crying spells, aggression, agitation, changes in behavior, hallucinations, thoughts of suicide or hurting yourself, sudden numb or weakness, especially on one side of the body, blurred vision, sudden and severe headache or pain behind the eyes, sometimes vomiting, hearing problems, hearing loss, ringing in your ears, seizure, convulsions, severe pain in your upper stomach, spreading to your back, nausea and vomiting, fast heart rate, loss of appetite, dark urine, clay-colored stools, jaundice, which is yellowing of the eyes, severe diarrhea, rectal bleeding, bloody, black and tarry stools, fever, chills, body aches, flu symptoms, my favorite, purple spots under your skin, easy bruising or bleeding, joint stiffness, bone fracture, bone pain. It also says here's some less serious side effects of Accutane. Discomfort with contact lenses, joint pain, back pain, feeling dizzy, drowsy, nervous, dryness of the lips, mouth, nose, or skin, cracking or peeling of the skin, itching, rash, changes in your fingernails or toenails. The list goes on. If I haven't made my point clear that you need to be off Accutane, or if anybody you know is on Accutane, you need to tell them to get off it, because their health is affected. And that shouldn't be the case when you're treating acne. In fact, it's the exact opposite. When you have acne, that means that your health is affected, and we need to address the internal causes and not give you drastically unhealthy medicines that could cause your future kids to develop weird things. It's just not fair. It's not fair to you, and you need to get off it. And it's turning into my mini mission in life is to take everybody off Accutane, because this is serious. This isn't a joke. I just read it to you, and the research backs it up. But for some reason, the FDA has not pulled this drug off the market. I don't know why, but they really need to. But that's all I got. So enjoy the rest of your day.
So that was the Accutane information. Again, I wanted to make it clear that this is my mission, is to get everybody in the world off Accutane, because it's not needed and it has too many harmful side effects, and people don't need to be living with that. So please, if you have someone with Accutane, or you know someone, family member, friend, whoever, ask them to check into our videos, start getting more information, because acne is really not that big of a deal, but Accutane is, and it can really damage your life and may even be a cause of death. So check us out, www.deathofacne.com. Enjoy your day.